and welcome to another episode of Caring for You with me, Dr. Terence Drew. And today we're going to look at tonsillitis, a very common ailment of the upper respiratory tract. What do I mean? In the throat area. So where are the tonsils located? Right in the back of the throat. And what is the function of the tonsils? The function really is to prevent infections and to fight infections, but sometimes the tonsils can become infected and as a result can cause significant health challenges. So what are the symptoms when someone gets tonsillitis? Number one, throat pain, inability to swallow. When you try to swallow, you may not be able to swallow, or even if you can swallow, it becomes very painful. People can feel the lump right here in their throat, and they can also develop a fever. They can have a skin rash as a result. The causes are viral infection, the common cold, for example, that virus can infect the tonsils, bacterial infection such as strep throat. And I want to spend a little bit of time on strep throat because the strep throat can lead to heart problems, rheumatic fever, can lead to kidney problems that we call nephritis, and bleeding in the urine. And so it is very important. It can also affect the brain and the nervous system and cause certain complications. So how would one know if he or she has tonsillitis? Well, you will visit your doctor, of course. The doctor will examine your tonsils and notice that they are red and inflamed, and they can have what you call exudate, which is the white stuff that covers them. You can also have lymph nodes. When you touch your neck, you can feel the lymph nodes. You can discover fever. But how do you tell if it is strep throat? There's a criteria that we use, and we look to see if you have a common cold, how the tonsils are looking, and to really narrow down whether or not this may be tonsillitis. But we can do what you call a rapid test, where we can take a sample from the throat and do a rapid test to see if this is strep throat or not, because strep throat is caused specifically by a type of bacteria. And if it is strep throat, then you need antibiotics. The antibiotics can be given up to 7 days, penicillin based, and if you are allergic to penicillin, you can take a different type of antibiotic. But other measures are, you can do warm salt water gargles, you can take paracetamol for pain and fever, and you might drink cool liquids to soothe the pain to some extent. And there are some antiseptic spray which have some local anesthetic in them that can help to ease the pain. But the antibiotic treatment, along with the other measures, usually cure tonsillitis. So I have already spoken to you about the various complications that you might have. But generally, this is a disease that, thank God for modern medicine, is curable, and you should always make sure that you visit your healthcare professional to get the necessary treatment. So I want to thank you for joining me, Dr. Terence Drew, on this episode of Caring for You.